Hello, and thank you for joining us for today's program, Building Physical and Emotional Safety for Your Employees as They Return to Work. This event is part of the SHRM webcast series. You can learn about upcoming and on-demand programs from our e-newsletters and the webcast homepage at shrm.org/webcast. SHRM thanks today's sponsor, Aduro, for making this program available to the HR community. And now about today's program. As businesses begin down the path toward reopening, employers are coming up with strategies that will allow their workers to return to the office safely, both physically and emotionally. Today, you're going to hear from a panel of health and well-being professionals who will discuss the stages of returning to work and the real considerations necessary for bringing employees back to work in a successful and sustainable way. To moderate our discussion, we're pleased to welcome Sean Bell, the Chief Operating Officer at Aduro. Sean, the floor is yours.
Thank you very much, Mike, and appreciate your support. We're going to first start with some brief introductions. Before we do, though, I did want to start this presentation by setting, a few ground rules for how we should think about this. Mike referenced the fact that in today's world, with a lot of these webcasts taking place, these longer length webcasts, there's problems with internet traffic, et cetera. Having been in many of these, and I know Dr. Todd and Amy, you have as well, there's also the problem of just sheer boredom of trying to follow along with slideware, people clicking from slide to slide, reading what's on the slide, and then moving on to the next slide. Our focus today is for the three of us to engage in what I believe to be a very relevant and timely issue that a lot of our folks on the phone are dealing with, which is thinking about both the physical and psychological safety and well-being of our employees in a time when there's tremendous challenges. And I challenge each of us as we talk through this to ask each other questions, to do follow-up in ways to engage ourselves and also hopefully bring a sense of interesting discussion back to the audience. I expect we're going to have a lot of questions, so I want to make sure we get through our discussion and leave that time to engage in that Q&A. So with that, I'll just briefly introduce myself. I'm Sean Bell, the Chief Operating Officer at Aduro. Aduro is a human performance company that is at the intersection of well-being and performance. We provide expert coaching, interactive content, meaningful incentives, and personalized insights and fun, inspiring ways to engage employees on a journey towards their own health and well-being. With that, I'd like to introduce Dr. Michael U. Todd, who is with us and joining today from Northern Michigan.
Hey, thanks, Sean. I really appreciate the warm handoff to me. Brief introduction. I'm the Vice President of Business Development for Bon Secours Mercy Health based in Cincinnati, Ohio. I'm the Medical Director of our Associate Health Plan as well as our Wellbeing Platform, and we have two internal capabilities. One is called Conduit Health Partners. I'm the medical director of that, and that is a care navigation company. We support not only our own associates, but other providers in our communities as well. And then another capability is called Harness Health Partners, and that's our direct-to-employer solutions company. I'm a family doctor by training, and if I could pause for just a moment, and I would love to acknowledge and thank all of our providers, all of our frontline providers across our country and across the globe who are putting their own lives at risk and stepping into their sites of work. So I just want you to think about all those providers in your community that are supporting the health and well-being during this terrible time. Secondly, I would be personally remiss if I didn't acknowledge the impact of the last several days. It's been very heavy and it's very saddening to me, and I just want to acknowledge that it's the sadness that's occurring in our in society today. With that, I'd like to pass it over to Amy for an introduction.
Thank you, Dr. Todd. My name is Amy Holen, and I am a licensed marriage and family therapist with a specialty and background in crisis management with mental health. And at Aduro, I'm a behavioral health coach, supporting members and supporting our teams with mental health support as well.
Thanks to both of you, and Dr. Todd, very grateful for your words there. It's actually really telling that we're here talking about physical and psychological safety, and in the sense that what's so incredible is this conversation just a week and a half ago would have been solely around COVID. And yet now we're now having to actually help our employees and their family members think about this elements of physical and psychological safety as it now relates to how this nation thinks about racial equity and how we think about basic elements of being safe citizens and engaging each other in thoughtful conversation around racism. So I'm grateful for you bringing it up because it actually now is, this conversation is now more telling than ever because it's now going to have a ripple effect across the board. So while we've labeled this navigating the COVID-19 crisis, I would suggest to all of us on the phone that this is a broader dialogue now that now has implications and reverberations across the spectrum of what our employees are dealing with. Amy, I know you've spent a lot of time thinking about this from a mental health perspective. Anything you want to add to that thinking to help set the context for our employees, for our audience members?
Yeah, I mean, I think that embracing what's happening right now and acknowledging that is really, really critical. I think we're all stunned and trying to figure out how to manage and how to cope in the midst of all of this, and also how to be supportive to those around us, particularly people of color. And so I'm so grateful to be part of that. And I think as we go into some of the elements we're going to be talking about today, specifically around trauma, I think you will find that there is a ripple effect and it will resonate with what's happening in the world right now.
Todd, I'm going to start actually by just quickly touching base on what's on the screen, but then I'm going to turn this over to you to talk about how this exact sort of perspective played out in health systems. It's telling, I believe it's like 15% of the U.S. economy is in healthcare. The GDP is actually healthcare related. Millions of people have jobs in healthcare. And this COVID crisis has actually forced them more rapidly than many other employers to have to move and be thoughtful about this approach. So as we talk about it, I think your perspective on how Bon Secours Mercy Health thought about this and how they're currently working through it is going to have particular resonance with the audience as they start their journeys. The purpose of this slide is to really get everyone focused on the fact that there's actually both a physical element of context and framework and a psychological context and framework on how a crisis plays out. When we were immediately hit with the effects of the pandemic and the focus on physical safety, the way we described it is literally like an initial earthquake took place. There was massive fear. There was a real shaking of our core foundations on even being in the same room with each other, how to be safe. That response was immediate. It was quick. It was panicky and reactive. And now we're in the phase where we're dealing with ongoing repercussions, whether it be flare-ups in certain areas, changes in whether or not people are getting, the curve is being flattened or not, or it's flattened in one part of the state but not in another. And so we're seeing this give and take that's happening that's really affecting people's thinking about when and how to return to work, what would make me physically safe, and how do I find psychological safety and decisions around that. The very term return to work is a little much of a misnomer because a lot of us have been working quite extensively from home. So we use that term loosely, but we're thinking about people trying to return back into a workplace. Ultimately, our goal is to get to a point where we've reinvented a perspective on how to safely engage one another, both physically and to be in a safe place psychologically. But that process is still unwinding. And I would love to hear, Dr. Todd, if you could just walk us through a little bit about how Bon Secours Mercy Health took on this challenge and how they worked through it.
Sure, Sean. Well, first of all, Bon Secours Mercy Health is in 4 states and also Ireland. We have over 60,000 associates, over 50 hospitals, and over what we call 1,000 points of care. So our immediate response was to serve our patients. And what can we do to serve our patients? So if you look at it, we're a large employer who has a very unique task right now. We really had to continue to serve and respond to the surge of COVID patients. Then we had the non-clinical staff, what I would call our shared services organizations, that we really had to make a decision. They were not necessarily the most important employee at that point. So we actually had a bifurcated approach. No doubt, we immediately built operational readiness to handle any surge or any bumps or resurges or whatever you'd like to call them or flare-ups in any of our markets. So we set up a task force, a multifunctional task force that included providers as well as executives to be operationally ready, to build the ICU bed capacity, to build the ventilator capacity, build the testing capacity. So that was the immediate response. We closed our shared services offices and moved everyone remotely, and that happened. We also had a furlough of approximately 700 associates. We are estimated to lose probably $100 million a month, close to that. So it was a catastrophe waiting to happen. And so after we, I would say, focused on our patients and our communities that we serve, building all that capacity is how do we reinitiate our clinical services that are not emergency services, our elective surgeries, elective procedures. So the angle there was we began to test not only our patients that we were going to serve, but also the associates that we're going to be caring for those patients. Again, with our other subset, our non-clinical employees, we're reinventing what that work site will be. Their work is ongoing, like Sean referenced. And as you can tell, I'm not in the office right now, and the shared services organizations are really in the office. So it was really bifurcated approach, if that makes the best sense, Sean.
It does. And I'm curious, when you looked at what you've gone through and all the challenges your team has dealt with, if there was one thing that you, in retrospect, felt like, oh, okay, we learned a lot from that, we would have done it differently the next go around, is there something that you would have your organization would have sort of said, aha, here's something really we wish we had done different, or we would have done it a little bit better?
A little bit in the weeds, but I want to explain why I think it's important. And again, across the nation, testing capacity is stressed. And some regions have great capacity, some do not. Our regions, for whatever reason, don't have great testing capacity. When we reinitiated or reactivated was our internal term. When we reactivated those elective surgeries, we tested our associates, and those were the clinical associates at that time, and our incidence rate was so low. So as an example, of 100 associates we test, maybe 1.9% of those associates were positive for COVID. So I don't think we wasted tests there, but we learned that our associate population was not at that point impacted COVID like the general population in most of our markets. So, and the reason I say this as a clinician is we need capacity right now. We need to test more to really reinitiate our revenue streams within this healthcare company. We need to do more testing so that we can get those elective surgeries that have been put off and chronic conditions, treatment for those chronic conditions have been put off to prepare our acute care sites for the surge that is, fortunately, hasn't hit us as hard as we expected, or the resurgence of the disease over the next couple months.
Well, with that, I kind of want to turn to this sample risk tolerance scale that we put up, because one of the questions that we're dealing with a lot with our clients is how to sort of think through where you are in the process. And the first question is to really get a feel for where your employees and where you as an employer are on risk tolerance. Now, this doesn't just apply now to COVID. If you're in, for example, if your offices are in a very dense metropolitan area that's currently dealing with protests or dealing with a lot of challenges on civil unrest, this would also be an applicable set of questions to ask, albeit maybe with some different decision criteria. Before we jump in, and I'm not going to spend too much time going through every one of these, but clearly what you can see here is that there are people who are going to be very aggressive in their thinking, and those may be people who have been in areas that have been very lightly impacted or continue to be lightly impacted, have yet to see a real upsurge or an incidence of a substantial amount of people dying from the disease, through people who are, like maybe in very, very affected areas, and have thought a little bit about, am I really, really ready to jump in and to do something here? So those all have an effect on like the number of days out before you would start planning to getting to a point where you could say, okay, maybe now we should start thinking about opening the office, depending on where you are in that. Before we talk about the elements of planning here that we've talked through a little bit, I'm curious, Amy, Could you layer in a little bit about how to think about risk tolerance, how employees and employers should think about the psychological elements of thinking about risk, how people manage it, and how they internalize risk?
Absolutely. I think that everybody is going to have a different perception on what feels risky and what feels safe. And so I think what you're seeing, you see it out in the community, right? Some people feel like it's completely fine to run to the grocery store and get groceries, while others are completely petrified to do that and are ordering grocery delivery into their homes. And that it layers out through different elements of our life too. I mean, things that we never thought about before, like touching a doorknob. Some people will find that that's incredibly risky now, whereas other people will feel like it's completely safe to do. So I think, what matters is that some people are going to feel completely safe and some people are going to feel completely at risk. And it's really important to empathize with both sides of the coin there.
Yeah, I think something that's really interesting about this discussion is there's sort of two or three things on this area of risk tolerance that I think we need to call out a little bit. One is this issue of what is organizational normalcy going to look like. One of the things that we've actually been talking quite a bit about is the fact that one of the elements of normalcy will be consistency in how the policies are put into place and are actually used, in the sense of even if someone's had COVID, for example, and potentially has antibodies that may be protective, although that's up for debate and discussion, and we'll be touching on that later. That doesn't mean they don't need to follow the same policies about checking in each day, wearing a mask in appropriate areas, because that inconsistency creates a lack of psychological safety for people who feel, normalcy will be defined by a consistent approach to things. That's one element of it. And then, of course, the other element of it is as well is really thinking through, like, have you actually put together the actual plans you need to think through, like, for example, what is your testing policy going to be? What is going to be your policy for symptom checking? What will you be thinking about as you work through some of the challenges associated with employee differences about wearing masks or not wearing masks? How will you address those? What will you do if someone, for example, refuses to follow along with a certain guideline because it's against their personal beliefs? These are all questions that employers need to think a little bit about that will affect that risk tolerance scale. And I'm curious, Dr. Todd, where, as Bon Secours Mercy Health had to work through this, how did you deal with employee perspectives around, being consistent, making sure people were all doing the same thing regardless of role, and what did you do if you had someone who had a different opinion? Was that something that had to be dealt with at an HR level, or did you deal it at a sort of discussion level? How did you all think about that?
Well, Sean, we had kind of a template with we're a healthcare company. So if you work for Bon Secours Mercy Health, annual influenza immunizations. We had that template. And the vast majority of our employees, associates, are clinical in nature. So I don't think the testing that we do, and for our clinical folks, our clinical associates, we're doing test-based screening. We do the checklist like everyone else, and then we perform a test. Now that's a little bit in evolution right now. For our non-clinical people, it will be symptom-based screening. So I think down the road we'll hit more of that, because our focus has been more on getting our clinical staff up and ready to serve the patients in the communities that we serve. So great question. I don't think that we've confronted that, especially that non-clinical staff who coming back to our administrative sites. But I think it's helpful for a faith-based organization that is mission-oriented, that's it's meant to serve the sick and the dying. So I think we're unique. I think my angle would be kind of not typical for the typical employer across the country. I know that's a little bit of a hedge, but
no, I'm not sure it is, because I think you got a lot. As I said, you are amongst the largest percentage of the U.S. workforce. 15% of our GDP is in the area of healthcare, and I'm sure many of our attendees are working in healthcare organizations or in essential organizations. We have a client, for example, that is in the grocery space, and we've had real interesting discussions with them about the fact that many of their employees have been de facto first responders. They have to go to work. They have to create a sense of normalcy for people. People are very nervous about buying food and getting food and being exposed. And so they've had to deal with a lot of the same challenges I think some of our healthcare folks have had to deal with. So I think your comments are actually quite relevant to that perspective, and probably has a lot more resonance for folks who have had to move into new positions or think about it differently.
Can I just plus this a little bit in what you were just saying? You know, I think all of us, if we go back a couple slides and looked at the initial response, all of us have prepared our work sites and thinking about that physical safety. And I think we've done a good job with that with our hospitals. And I could go into detail about that, but it's not worth it right now. It's really the psychological safety that I think is going to hit us. And Amy, I'm curious, me as an executive advising HR leads within our own company, from a psychological perspective, psychological safety, I mean, when is that going to hit us? Is that going to hit us now that we need to deal with this, or is this 3 or 4 months down the road when the work site safety, the site safety is more normal?
I think it's going to be both. I think that we're experiencing a trauma right now. And I think that what we know about trauma is the term that we all know and know very well is post-traumatic stress disorder. And so I think a lot of the symptoms that we'll experience, it's definitely going to come later, but I think we're all experiencing a little bit of that right now. I mean, we're right in the middle of it. So I think we're going to have stuff happening right now and experiences happening right now. And I think it will come later as well.
Great. Thank you.
You actually opened up a great entree into the next sort of discussion point, which is thinking about work readiness in general. So I want to spend a minute talking about the transition from stage 1, not being ready to head back into the work site, to creating a safe environment for people to work, which has a lot of physicality around it. And that has a lot to do with policies and procedures. And I want to touch a little bit about how we've talked about that and give a little bit of a framework. But then I do want Amy to jump in to talk about the transition from physical safety to psychological safety. You know, there's this issue that we need to be upfront with each other on in this discussion, which is, let's all be honest. Psychological safety of our employees, for the most part, was not something that was everyday discussion in the workplace on an ongoing basis. It was given, you know, like Mental Health Month is in May, and it's always given a perspective, and it's talked about, and you know, it's something that's thought a little bit about. But most employers have not, and for the most part, put together a deep, rich, thoughtful process about creating a sense of mental resilience and psychological safety in their workforce. It's been very much pushed to the role of EAPs to be reactive to someone in crisis without thinking about the broader group. So I would love Amy and Dr. Todd to, as we go into that area, to start thinking up a little bit about how that evolution, COVID has forced that evolution, or revolution, I should say, around that topic, and we'll be prepared to do a deep dive on that. Before I do, though, I do want to quickly touch base about this idea of physical safety in the workplace. We, and I know other providers in this space, have all been working very closely and carefully with employers, our employer clients, on this topic about thinking through three things: process and procedure, legal and elements associated with that, and then the elements of creating a sense of resilience in the organization. And that third piece will touch into our piece on mental well-being. Around the processes and procedures, really what we've tried to get a lot of our folks thinking through a lot is how to create a hybrid model. And Dr. Todd, you talked a lot about that in the beginning, this idea that in the we're not going to have a big bang. There's actually no objective period of time when we can say, okay, it's safe, everyone can go back to work. It's a lot about individual organizations' views of what is safe, when it will be safe, and that's going to vary by company. But to create that sense of physical safety, creating a sense of like, okay, when can I work from home? How many people are going to be in the office on any given day? How will we handle things like kitchens? How will we handle things like conference rooms? How will we handle things like bathrooms? How will we handle entrances and exits to the workplace? These are all questions that are now coming up that actually have to have very specific answers to them. And the intention of this, we could eat up the entire hour on that topic, but those really are what I would call table stakes for psychological safety, is the getting aligned fairly quickly on these elements of physical safety. Thinking things through, like what is essential, how frequently does someone need to be in the office, can they continue to do a day in the office and a day from home to limit their access? How will we handle things like public transportation in cities where it's a major issue? So those are all elements that are table stakes on that. But I would really like, Amy, if you could first start and talk a little bit about, as we work through this working model and we start to think about moving from safe to well and then well ultimately to engaged, how do we think about these elements of mental health considerations and how should our audience start to really turn that into practical questions and steps they should take?
Absolutely. Well, there are a few things that we really want to consider when we think about mental health and the considerations surrounding that when we return to the workplace. And that includes, as you can see, trauma, the length of the crisis that we're all in, and the increase in substance abuse that's happened as a result of being in quarantine for as long as we have been. So I think if we really focus on the trauma piece, it's really important to recognize that we're in the midst of a worldwide unprecedented crisis, and that crisis is resulting in all of us experiencing a tremendous amount of trauma. And the trauma we're experiencing is very complex. As you said, Sean, earlier, it feels like things are changing all the time. I mean, we hear about what some states are doing versus others. For some people, there's a sense that there's no end in sight. And we have constant alerts about more cases and more deaths. And then there's that fear about a resurgence and another quarantine looming. So there's the smaller things that we take for granted as well, that we had once taken for granted, like the doorknob example that I used earlier, where we felt very safe about touching a doorknob, and now people are thinking twice or feeling the need to hand sanitize right afterwards. No matter what's right, if you hand sanitize or if you don't, I think it's just the fact that we're thinking about the doorknob that's really symbolic of the collective anxiety we're all holding. I think the trauma that we may have and that we may experience, Dr. Todd, you brought this up earlier, if it's happening now or if it's going to happen later, I think that is going to show up differently in different people at different times. Some people might show that they have feelings of sadness, while it shows up as anxiety or fear. And for others still, it could be anger or hostility. And that really can impact the relationships that we hold at work and in our world, in our communities. And then also it might impact collaboration and focus and productivity as well. So it's really important to consider this. Yeah, absolutely, Dr. Todd.
I add to that, just how we're thinking about it within our company and our HR department is we're viewing we're taking the view that everyone, all of our associates are at risk. Everyone that has experienced a trauma. Now, there will be some with underlying mental health issues that there potentially will be an exacerbation. Then you've got that group of associates that I would say they're on the edge of falling into mental health. Now, right now, they're being pushed into that. And then there's the rest of us who are normal, and I'm saying I'm normal, not so much Sean, but I know Amy's normal, that we're even at risk of being pushed into a mental health issue. We all have anxiety right now. That's a mental health issue. And so if we bucketed all of our associates, hey, we're all at risk. And I think the most important thing we have done to address that is for leadership to strongly and transparently communicate that out to all of our associates on a regular basis to destigmatize mental health as a medical issue, just destigmatize it. We relaunched our EAP program and remessaged it out, added capabilities or highlighted capabilities. So I just love the idea that our leadership took the initiative to communicate on a very transparent level like never before. Just wanted to add that.
The thing I really love.
Oh, go on, Amy.
I was just going to say that the thing I really love about what you said is that it's not just, if we can take some of the stigma away from this, if we can really look at mental health as maybe the foundation of what we all stand upon, and that the second that we start to experience some mental health anxiety, depression, any of the things that can come up for a variety of reasons, it just takes that floor right out from underneath us. And so it's really important to take away that stigma, and we do that by being really open and having open dialogues like we're having right now.
And just one other add to that. So we've got 70% of our workforce, if not more, are nurses who are being traumatized, not only because of the crisis itself, but also caring for all of these individuals going through it. And so we have this term internally that we're calling emotional PPE. We all know, no one knew what PPE was 6 months ago or 3 months ago. Now we know what PPE is. So we have something called emotional PPE. We foster that by having twice a day what we call pauses, where it's an 8-minute mindfulness exercise that anybody can tap into, and it's live. And it's just a mindfulness exercise for those frontline providers. And it's part of our emotional PPE garment, if you will.
Love that.
I love that idea, and that's a fantastic way to think about small steps you can take in the organization that don't cost anything but can have huge impact in the long run. I would suggest when I'm listening to you both, there's 3 things that I would specifically add into our HR executives and teams to quiver to think a little bit about. One is, don't assume you know exactly how your employees are feeling. Ask them. We actually just did a survey at Aduro on people's thinking about their readiness to start to return to the work site as King County starts to move through. King County is in Seattle, where we're located, Aduro's located, and it's getting closer to being able. We're probably 2 to 3 weeks out before we could start opening. And I was surprised by the results. 25% of the responses were aligned with that they are absolutely not ready to come back. They're too fearful. 25% of our folks were aligned with they would need a lot more information about the specifics about how to consider, how are we going to be handling all the physicality and that. And 25% were unsure either way. Only 25% of our folks were ready to come back. That means 75% of our folks need more information. They need more support, and that is a huge eye-opener for us as we think about preparing for our back to work or coming back into the work. So that's the first thing, is to survey. The second thing is to really, really think about the amount of training you need to give your managers to be able to handle these elements of what employees are going to be dealing with. This is not a linear cycle people go through. The grief cycle is not linear. There's information, communication, emotional support, guidance, and direction, and people can start in one place and go back into another over a period of time, depending on changes in news. So how are you training your managers to actually be able to handle this? And then the third element would be giving employees some space. As you think about your HR policies and how you enact, for example, how you think about discipline, how do you handle disputes in the workplace, be prepared you're going to have more of those. Be prepared for the fact that many of these may be embedded in some of these elements here, and a strict decision about, okay, when someone does this, we respond in this way, may need to be renewed or reviewed in light of what's going on around that. Does that make sense, Amy or Dr. Todd? Anything to add to that before we move on?
It does make sense. And again, I just added to my perspective. I work for a faith-based organization, and the idea of grace, it's much easier in our organization. If you talk about a manufacturer in the Midwest who's manufacturing widgets for the automobile companies, it's got to be a challenge. But it's much easier to, I think it's much easier internally for us right now.
I love what you said.
Yeah, agreed. Amy, do you want to add something to that?
Oh, I was just going to say I love what you said, and I wanted to highlight that again about the grief and loss process, which we're all experiencing right now. We're all experiencing grief and the sense of loss of our freedom and our ability to go outside and a lot of the things that we've been going through. And it's not linear, and I think that that's really important to highlight, that you can come in and out of that cycle pretty rapidly, and that's okay.
And as we think about stepping through this work readiness model and moving ourselves from this idea of moving from safe to well and well to engaged, there's this idea of ultimately getting people to build a sense of resilience, to be able to bounce back from difficult times. Amy, could you first define resilience for people and then talk a little bit about what it actually plays out in the workforce?
Yeah, I think really putting it simply is resilience is our ability to bounce back. And we are, I know that that resilience that we all have innately can really be emphasized by the way that we approach how to support people in this time. And I think that, Sean, you pointed this out earlier, and I think it was really perfect, is being really clear and consistent in your messaging. If you are requiring masks, not everybody's going to like that. And likewise, if you're not requiring masks, not everybody is going to like that as well. So really, but being clear and consistent in your messaging, and really building that sense of psychological safety by really empathizing that emotional impact that is going to happen as a return to work happens and occurs.
When I think about resilience, I love the idea of snapping back, but I also know that this isn't going to go away July 1st or August 1st for that matter. So I liken it to a car, and I'm showing my age, driving down the highway at 65 miles an hour, and it appears great. It's operational. It's getting those passengers to where they want to go, but then the hubcaps start rattling a little bit. I'm curious, Amy. No doubt we're in it for a marathon and not a sprint. And I think you would support me if I said that, we've got to, as managers right now, we've got to be ultimately very sensitive to those hubcaps rattling and jumping on that as quick as we can and using available resources that your company may have to either some self-care, whatever that looks like, EAP programs, those kind of things as well, I'm sure. But managers really spending the time to identify when those hubcaps start rattling.
Absolutely. And I think creating that foundation of having an open door policy, just really creating that sense of safety to come and talk to you about things when things are, when those hubcaps are rattling and coming off, really knowing what is available to your employees. What do you have available as far as your EAP support? What do you have available through insurance for therapy and for other supports, including substance abuse treatment, et cetera. So I think really trying to set that foundation of we got you, we understand that this is going to be a really tough time. And even if you have the most resilience in the world, you're still going to be facing some challenges as you return to work and just in general as we are going through this over the next several months.
Yeah, thanks.
Yeah, and what you've all said is so challenging, this idea of the hubcaps rattling. One of the challenges we've had in psychological safety in organizations and thinking about mental health and resilience is that we've siloed that element of our human resources into either an EAP or into a network. And by doing that, we've actually not spent a lot of time as organizations addressing the role of mental health in the organization. And we're not talking about mental illness. We're talking about mental health, how people feel, how their anxiety and stress on a day-by-day basis, whether it be financial stress, whether it be dealing with the stress of trying to take care of family members right now, whether it be dealing with a concern as to whether or not your career is going to change or when can you start going back out. The effects of that are incredibly profound, and from a return on investment perspective on work performance, so critical to think about how you integrate these perspectives. We have here a slide that touches on the fact that there are different elements to return to work. There's this idea of, like, when possible, doing the right, using digital tools to actually monitor people from home so they don't have to come into the workplace and expose the workplace in order to be checked. There will always be room for on-site screening and the need to do that, particularly if you're a retail organization or if you have a lot of visitors in the org, to handle those pieces. But this element of mental health, how do you actually get this silo broken down and build out an infrastructure with the right tools that link well-being, mental health, and performance into a single perspective is so critical right now. And something I think right as we move away from the reaction into the reinvention that we started the discussion will probably be one of the key elements as we think about how our evolution in the workplace is going to come together. Dr. Todd, I want to turn this over to you now, because one of the things that we get a ton of questions on is people's complete confusion around, if I'm going to feel physically safe and help people feel psychologically safe, I need to figure out my testing strategy. And people were all over the map about what to test for and how to test. So I'd love for our last couple minutes before we go to Q&A to touch on this.
Well, thanks, Sean. If I could say one thing, yeah, there are three categories of tests. You've got the PCR test, which is testing for the presence or absence of the virus. You've got this antibody test, and then you have the antigen test. There is only one that I would trust as a provider right now that has a high enough sensitivity and specificity that I would guide my workforce back with, and that is really the PCR testing. Antibody test, right now, there's confusion about it. We don't know what the levels of antibodies, whether they're IgG you'll hear about or IgM, if that infers immunity at all. And the antigen test is so you know, is a point of care test. It's this is one of these tests that it's like a rapid flu test in an ambulatory office where it just takes minutes to identify whether the virus is there or not. That's not there yet. Antibody test and antigen tests, I'm uncomfortable developing a return to work testing program with either of those two categories of tests. And that makes it a challenge because of course, we all know about the capacity for testing within PCR testing. And we also are concerned that, if you don't do it in a timely manner, what does it mean and how do you even fold that into a testing strategy? So all of them have their advantages when they would all be developed. All of them have their disadvantages because of the timing mainly and the sensitivity and specificity right now of the antibody tests. So if we could all rally around as HR leads, we've got three categories of tests: PCR test, antibody test, and antigen test, and all land on that. We shouldn't be developing a workforce return to work strategy on antibody or antigen test at this point. 6 weeks from now, 8 weeks from now, 4 months from now, we'll have a better understanding of what the antibody test and the ratios of antibodies. I hope that makes sense for everybody.
One of the things we've actually taken the model around has been to tell people that they're going to actually need to take a layering approach, because to your point, like it's telling you tested all your associates, only 1.9% of them actually tested, even if they were asymptomatic, because they probably have been scrupulous around their use of PPE and around personal protection and distancing. So I think one of the elements to this is what we're telling our employers is that you actually have to think about this from a multi-layer effect. One is do as much symptom checking remotely using the right digital tool that could allow for input of a temp as well. Consider how you're going to be checking folks at the door to try to limit. That could just be a forehead screen. But the goal there is to try to capture symptoms before people show up. But regardless, given the percentage of asymptomatics, still follow social distancing rules, even if people have done symptom checking in the office as a consistent model with the right amount of protection, and leave the testing, given its limits right now in terms of availability. If someone is showing a symptom, send them to be tested to determine whether or not they should quarantine for 14 days or if they just have another health condition that has popped up in the interim. So that's sort of been the thinking. Dr. Todd, does that align with your overall point of view you just shared? Do you have anything new to add to that or different?
Nothing new to add to that, but I reinforce what you said. I agree with that.
Great. Okay, we're going to finish up and go to Q&A. The last thing we did want to leave, and we'll leave this on the screen during Q&A, is that we have put together certain resources that are available for folks to be able to look into. And some of them are Duro-specific, but many of them are available, Duro-specific in the sense that we wrote them. Anyone can click on the links, obviously, and get to them. But we also do have national other areas where there's a substantial amount of resources that employers who've not yet gone down this pathway can find very thoughtful, evidence-based approaches. And I would stress that word, look for evidence-based approaches to what you're choosing to do and how to do it. And if you're not sure, ask. So with that, I'll turn it over. Mike, if you wouldn't mind, we've got 13 minutes left. We'd love to open up Q&A. I know there was a bunch of questions that were popping in, so please feel free.
And we will turn to audience questions in just a moment. SHRM thanks Aduro for sponsoring this program and SHRM's series of free webcasts. Aduro is a human performance company unlocking human potential in the workplace by providing expert coaching, interactive content, and personalized insights in a fun and inspiring way. Aduro works with organizations to promote the growth and flourishing of their people. In response to COVID-19, Aduro created a work readiness handbook to help execute management teams create a plan for when and how to allow employees, visitors, and service partners back into the workplace. You can download the handbook at adurolife.com/whitePapers/work-readiness-handbook. That address is on the screen. It's also in the PDF of the program slides you can download. All right, let's turn to audience questions. We'll start here. One of our viewers asked, individual risk tolerance will depend on individual risk factors such as age, co-occurring disorders, employment context, etc. How can we respect the actual risk to each person in their own circumstances?
Let me start, and then Dr. Todd or Amy, please feel free to jump in. First, I want to be super clear. I'm not a lawyer, but I will give some perspective on how we've been talking about it. It is unclear at this moment in time exactly what elements of the Americans for Disability Act will or will not apply as we think about COVID in the future. But nonetheless, we should all go into this with a framework of being very thoughtful about creating reasonable accommodations for individuals that allow them to feel both maybe not just feel, but actually be physically safe if they are in a situation where they may be immunocompromised or caring for someone who are immunocompromised. And that is all affected by risk factors such as age, chronic disease condition, et cetera. So as we think about reasonable accommodations, what we have to ask ourselves is, in the event that someone's not comfortable coming into work, how capable are they to still be able to do their job from home? And if they've shown thus far their ability to be able to deliver work in a reasonable fashion and in a way that's been working as we've all been working remotely, is it something that can be extended in a reasonable and thoughtful way? So we've tried to be, that's why we talked in the beginning about this idea about a hybrid model that I think organizations for the foreseeable future should be prepared that there is no big bang return to the workplace. We will have people for various reasons, either psychological or physical, who cannot or will not return to the workplace, but are still valuable workers, and how we support them that allows them to do their work thoughtfully and remotely has to be considered. And frankly, we've already learned a lot about how to do that well. So I'll pause there and see if there's any other comments from Dr. Todd or Amy before we go to the next question.
Amy.
I think when it comes to co-occurring mental health disorders, I think it's really important just to pay very close attention to how to be very supportive and empathetic to those needs as well. So just really considering what somebody already has as a baseline, and then how this trauma is being layered on top of that can increase those symptoms. So just being really supportive, being really empathetic, and really nurturing to how to get them the support that they need.
And just to add to that on a personal
Good point. I'll go on, Dr. Todd, please.
Yeah, just on a personal note, one of my team members is a young man who has a chronic condition that puts him at risk. And here I would think that he would have no anxiety about it. He self-reported that he had this chronic condition. And Amy, you said it, I mean, you have to be an empathetic leader to understand everybody's readiness from their perspective.
I love that, and I would just add for all of us and who work with our human resources folks to keep it. And I remember the difference between sympathy and empathy. Sympathy is not what people need right now. They need empathy. They need to feel a sense of shared connection over the struggle versus feeling that someone feels badly for them, and that will allow people to feel they feel that they're trusted and validated. And those processes will take them to the ability to take those steps forward around their own safety. Mike, can we go to the next question?
Yes. Audience member asks, can you cite one or two top things HR offices can do to support psychological safety in the workplace?
I'll touch on that quickly. And Amy, Amy, do you want to start, and then I'll add 2 points when if you have something to add, start with?
Sure. I mean, I think that some things that we've touched on already, which I think are pretty important, which is creating an open door policy, being really clear and consistent with your messaging to your employees and what's expected. And then also knowing the ins and outs of what you have available as support mechanisms to your employees is really, really critical in providing that sense of safety.
Well, I would add 2 or 3 things to that to expand it out even further. One is we talked about the idea of actively surveying your employees frequently to get a pulse on how they're actually feeling and what their concerns are and how and then bringing that data back to them and reflecting on what you've learned. I think it's really important for people to see that cycle. The second element is to really, for the HR offices to understand they are one touch point in an organization, but as the organizations get bigger and there's more employees, it becomes harder and harder for people to necessarily get in through the open door or even necessarily to always feel comfortable. They may feel much more comfortable talking to a manager or a coworker. And so how are you as an HR department training your managers and other organizations other people in the organization to be supporters, to be the empathetic touch points? You know, we call them fire starters, the people in the organization who can help ignite a movement or help ignite a perspective. And I think that's another key element HR offices should think about.
And let me just plus that a little bit. And this is a plug for community healthcare providers. As an HR professional, please reach out to your local providers. They're willing to help. This is their subject matter expertise. And there is no question that may lend a level of validity to the messaging that is coming out from the company, that you worked with whatever the local provider is to develop not only a physical safety, but a psychological safety program or protocol to get return people back to work.
Some questions here on dealing with the impact of COVID-19 and the return to the office. One of our viewers asked, can we require testing before employees return to work?
That's actually a legal question, and that will vary by state. So I actually don't think we can answer that directly outside of saying I would be very careful about requiring testing for the reasons that Dr. Todd talked about, which is the information you're going to get from the testing is not 100% accurate in either direction. So you either create a false sense of fear or a false sense of everything's too safe if you solely rely on testing, or if you require folks to test in order to get back. I would instead suggest you use symptom checking and ways to touch base and test folks who have symptoms and then still continue to follow social distancing, assuming everybody may still be able to carry the virus forward. Dr. Todd, anything you want to add to that?
Be consistent with that protocol. Don't flex at the first positive patient or employee that you have. Be consistent. We've had a couple different clients that have changed their protocols based on their first positive case in the work site. And I would just encourage you to be consistent. And then as testing capabilities change and the validity of the antibody tests we're more and more comfortable with, then I think you can begin to change that. But that's where I think working with the local health community is of value.
And another audience member asked, do you recommend employers conduct contact tracing if there's a confirmed case of COVID-19 in the workplace?
Can I tackle that?
Excellent question. Yeah, please. Go for it. Dr. Todd, please.
So lean on state and local health departments. State and local health departments right now are standing up contact tracers. I can speak to 4 states, but I'm sure this is occurring across the country. When a test is positive, a COVID test is positive, that's a reportable disease, and that's reported to the local health department and then up to the state health department. There's a protocol that the health departments follow, and they do the contact tracing in the community. Now, you can augment that and enhance that and by developing some sort of contact tracing capability inside the workplace. Again, legal issues and actually platforms are available, but please consult your internal legal counsel before doing that.
Yeah, I agree. I think the one thing I would add for HR folks to be very thoughtful about in these discussions is I do worry about resistance. One of the examples I've used in some discussions is you think about people's resistance when 9/11 happened and the TSA was put into place. And what were considered to be arbitrary or overreaching approaches to protection led to a lot of resistance and anger around the topic. And to this day, you still see people getting so frustrated and angry over what they believe to be, arbitrarily needing to take off our shoes, millions and millions of people each day, or at least previously when we were all flying. I think the question you need to ask yourself is twofold. What are you going to do with the information, and how well can you ensure that you're using it solely for what you need to be able to reasonably support an organization? Is an organization really expecting to do contact tracing outside of the workplace or just inside of the workplace? And if it's inside, at what level and how far and how detailed are you going to get? Are you going to track people going to the bathroom? Because people are going to be pretty upset about that eventually, and will find ways to get around it. So I'd be really careful about this before you dove into figuring out a contact tracing that may be very effective on one level but ineffective in another.
All right, with that question and answer, we are going to have to bring today's webcast to a close. Before we sign off, a couple of final thanks. First to our panel today, Dr. Michael Todd from Bon Secours Mercy Health, and Amy Holen and Sean Bell from Aduro. Thank you for sharing your insights today. And to you in our audience, we thank you for joining us for this program and for choosing SHRM for HR webcast. That concludes this event.